table because in the testicle we are familiar with this germ cells entity, but I still want to uh, highlight some of the method how I remember and differentiate all of these entity. So first one is this germinoma in the ovary. The counterpart is seminoma in the testicle. The forming nest of tumor cell separated by fibrous septate. The fibrous septate usually you will find lymphocyte. And then Yosnak tumor, they usually forming this reticular microcystic structure and Schurter dual body. That is the characteristic for this entity. And then embryonal carcinoma, they can form in granular and papillary architecture, but this is not really important. More important is that you think really ugly tumor cell in testicle and ovary. You should bear in mind embryonal carcinoma and choroidal carcinoma. But in choroidal carcinoma, you usually find multinucleated syncytial trophoblast, which you could not find it in embryonal carcinoma. So you need to really look at it and find it to call. And then the last entity is spermatocystic tumor. And then in contrast to our seminoma, the population in the spermatocystic tumor is much older than our seminoma. Seminoma usually just younger patient. Spermatocystic, you may find 60 years old, 70 years old. It's really rare in an older gentleman to get seminoma. So you need to think about spermatocystic tumor. And then not found in the ovary. No spermatocystic tumor in the ovary, just in the testicle. Characteristic is 3 cell type, small lymphocytes, light cell, intermediate size cells, and then the giant bigger cell. And then you can see I list 8 immunostaining to differentiate all of this entity. How I remember this, I just divide into 2 categories. The first 4 is the germ cell marker. And then in seminoma, this germinoma as a really strict parent, they have all of these marker positive, germ cell marker, OPT4, cell 4, CD1171, aka c-KIT. PLAB is placenta-like alkaline phosphatase. So all of these 4 markers should be positive in this germinoma. And then cell 4 and PLAB are the most sensitive marker. So you should estimate when you do these 2 marker, you may see your germ cell tumor should be positive. If you find cell 4 positive but PLAB negative, highly suspicious of spermatocystic tumor. Those Yosnak tumor, you may find either positive or negative. But this is a method how to remember. PLAB negative spermatocystic tumor. Then you just, based on cell 4 and PLAB immunostaining result, you don't really care about the OPT4 and CD1171 to make the diagnosis. Though you can still do all of these 4 marker, and then you find cell 4 positive, germ cell tumor, PLAB positive, you are really comfortable to call germ cell tumor. Then if you find AFP and glypican B, both positive, that is Yosnak tumor. If you find germ cell marker plus CD30 positive, embryonal carcinoma. Germ cell marker plus HCG, choroidal carcinoma. So that is how I remember this immunostaining. Do not really pay attention to OPT4 and CD117 because it's really confused. Okay, just show you some marker. I can give you like 5 seconds to think about it and then I'll tell you the answer. So solid sheet, But even in this power, you can see, oh, some cell is big, some cell is medium, some cell is really dark like lymphocytes. So this bleach delta is characteristic for spermatocytic tumor. And then if you are thinking about seminoma, but you do not see any fibroseptate with lymphocytes. So even in low power, you do not think about seminoma. But you can bear in mind, put it in your differential before you have these high power characteristic cells. The next one. Okay, this is seminoma because we can see necks of cells separated by this fibrous septate, lymphocyte in the fibrous septate. You really do not tell, oh, maybe this is a bigger cell, small one, medium one. No, they are not the same, really the same most of the time. This is seminoma or this germinoma. Remember the immunostain marker, all 4 germ cell markers should be positive. Classic one. I will highlight some cell here. Okay, if I don't highlight it, the first impression is that, oh, really nasty, ugly cells, really hemorrhagic. Then your major differential is embryonal carcinoma or choriocarcinoma. But when I highlight this multinuclear syncytial trophoblast, this is choriocarcinoma. And then our marker is HCG. The next one. Okay, papillary structure, really nasty atypical mitosis, cystic or microcystic structure, nasty cell, but no multinucleus syncytial trophoblast. So this is embryonal carcinoma, CD30 positive. And the last one. What's this? Suraduro body. What is suraduro body? That is where we see this vascular lumen surrounding rosette by this tumor cell. This is the follicular reticular cystic structure characteristic for Rosette tumor. AFP, glypican 3, characteristic marker. Thank you so much.